welcome to another enlightening episode of MedSynapse podcast. Today, we dive into a crucial topic of preventive measures of type 2 diabetes complication. With type 2 diabetes on the rise, understanding how to prevent its complication is more important than ever. From early intervention strategies to latest advancements in the medical technology, we'll cover it all. To guide us through this discussion, we have the esteemed Dr. Kiran Pasam. Dr. Kiran is a renowned endocrinologist with a stellar academic and professional background. He holds a DM in endocrinology and metabolism from AIIMS in New Delhi, India. He is also a visiting consultant at Mayo Clinic in Receptor. Currently, he is a consultant endocrinologist at AIG hospitals in Hyderabad. Dr. Kiran has numerous accolades, including top rankings in AIIMS entrance exams and several prestigious awards in endocrinology. Dr. Kiran, it is a privilege to have you with us today, and thank you for joining us.
Yeah, thank you, Hetri, for a wonderful introduction for me and inviting me for this discussion on behalf of MedSynapse. So I'm looking forward for this interview.
Thank you. To start off, could you share your medical journey with us?
Sure, Hetri. I have started my undergraduate in 2006 and completed my undergraduate from Karnool Medical College. So after that, I did my MD in internal medicine from RIMS, Kadapa. After that, I worked as a senior resident in All India Institute of Medical Sciences in internal medicine and PD of diabetology in JIPMER. And then again, I came back to All India Institute of Internal Medicine as a DM resident. So I have finished my DM residency in endocrinology and metabolism and joined as a consultant in AIG Hospitals, Hyderabad.
Yes, that is an impressive journey. Now let's dive into our topic. Can you share some early intervention strategies that have proven most effective in preventing complications in type 2 diabetes?
Yeah, sure. First, let us discuss about what are the complications you people face when they have type 2 diabetes mellitus. So complications can be like microvascular complications, retinopathy, neuropathy, and nephropathy. And macrovascular complications like cerebrovascular accidents, cardiovascular accidents, and peripheral arterial disease. Along with these complications, there are many other complications like infections, like dental infections and lung infections, abdominal infections, and urinary infections. So there are many complications which occurs because of the uncontrolled diabetes mellitus. So first we have to control the glucose. So glucose, it has a range between 70 to 180. So if a patient maintains a range between 70 to 180, so patient will have less complication rates. That doesn't mean that he'll not develop complications. So he may develop complications, but the pace at which the complications develop will be delayed. For example, recently a study from PMI Indian group, so they have studied the development of complications from 2013 to 2019. So even after the glucose control, so there was occurrence of the complications in the PMI Indian groups. So but the complication which occurred in the PMI Indian group were less when compared to the non-intervention like uncontrolled diabetes mellitus patients. So that's how, so controlled diabetes mellitus will prevent complications in the patients. For example, how you control glucose hyperglycemia in the diabetes patients, like for example, you have to concentrate on the lifestyle interventions. So what are the lifestyle interventions? Like one has to concentrate on the diet, so they have to eat balanced diet. So what is balanced diet? So balanced diet has good proportion of carbohydrates, proteins, fats. So if a diet has all these not equal proportions in the proportions which it should be there in the ideal diet, so then the patient may have control in the glucose status. Apart from, along with this diet, so patient should concentrate on the physical activity also. Like for example, they have to maintain 150 minutes of exercise in 1 week, and they have to concentrate on the muscle strengthening exercise. So all these things they have to concentrate. So these are the lifestyle modifications they have to maintain to prevent complications and glycemic control. And along with this, they have to avoid smoking, alcohol. So these are the risky behaviors. So if they control these risky behaviors, they can prevent the occurrence of complications at an younger age groups in the diabetes population.
Yes, thank you, doctor, for highlighting the importance of early interventions in diabetes care. Now, what are the best practices for managing common comorbidities associated with type 2 diabetes, such as cardiovascular diseases, to prevent further complications?
See, so if the best practices are includes like they have to go under regular medical checkups. For example, so each complication has a different screening approaches. For example, if a patient wants to prevent retinopathy, so he should get annual fundus checks, that is annual eye examinations. So if patient wants to prevent foot amputations or foot damage or foot ulcers, so patient should get annual foot examinations. In the same way, if a patient wants to prevent to in going into the chronic kidney stage, or if a patient wants to prevent himself in going into the dialysis, so he has to get regular kidney checks. So that's how a regular health screening or yearly screening for all these complications will prevent the patient. Apart from these regular health checks, so one has to concentrate on the his cardiovascular, cerebrovascular health. For example, we concentrate the patients under this approach, like ABC approach. So what is ABC approach? So A is for HbA1c control. So if a patient controls his HbA1c under less than 7, so then rate of complications will be less. In the same way, what is B? B is for blood pressure control. So if a patient who has diabetes, so if he controls the blood pressure, so he can prevent the cardiovascular, kidney and stroke complications. What is C? C is nothing but cholesterol. So if patient controls his cholesterol either by eating good diet or balanced diet or low glycemic index diet, or if cholesterol is more, so we can start a patient on statins, fibrates. So all these things will control the cholesterol. So if a patient controls this A, B, C, so the other cardiovascular, cerebrovascular, renal, all the complications can be prevented.
Yes, that was quite insightful. Now, can you discuss the significance of weight loss management in diabetes and prevention of complications?
Yeah, so weight has an important role in the diabetes pathology. For example, a obese person. So usually, worldwide overweight or obesity is defined as BMI. BMI more than 25. So what is BMI? So it is the ratio of weight and height. Okay, so if BMI is 25, patient will have risk of developing the complications related to obesity. So, but in Indian population, the BMI is 23. So 23 is the cutoff, which is considered as a normal BMI. So if you don't maintain this normal BMI, so patient has a risk of developing complications like diabetes, sleep apnea. Okay, so insulin resistance, all these things will be developed. So how this obesity causes these complications? So it increases the inflammation in the body, it increases the insulin resistance in the body. Okay, so it increases the blood pressure. So all these things are, it increases the cholesterol levels. So all these things are caused by increased weight. And if you control this weight, so at least some 5 to 10% of weight loss has been seen, so then there will be a significant improvement in the comorbidities, like blood pressure will come down, diabetes will come into control. And if you reduce the weight loss to at least some 10 to 15%, so the other complications like fatty liver, okay, diabetes remission also can be seen with the these amount of weight loss. So that's how weight loss is an important thing in the management of diabetes and its complications also.
Yes, and I think even lifestyle plays a major role in this.
Yeah, you're right, Hetvi.
Now, how do medications like SGL2 inhibitors and GLP-1 receptor agonists prevent diabetic complications?
See, diabetes management in the earlier days, so first line of management used to be metformin. But nowadays, so there are new medications like SGLT2 inhibitors and GLP-1 agonists, so which is going to replace the metformin in the first line management. So recent ADA guidelines all propose that SGLT2 inhibitors and GLP-1 analogs should be tailored to the patients based on the comorbidities. So coming to the SGLT2 inhibitors. So SGLT2 inhibitors, what are they? So they are the drugs which act on the kidney and prevent the absorption of glucose into the body and shunt out the glucose through the kidney. So that's how SGLT2 inhibitors work. So in India, we have empagliflozin and dapagliflozin. These are the most commonly available, and canagliflozin, commonly available SGLT2 inhibitors in India. And coming to the GLP-1 analogs, these are the advanced drugs. We can call this GLP-1 analogs as incretin hormones also. So what is this incretin hormones? So incretin hormones are the hormones produced from the gut. So there is an intricacy between the gut, pancreas, so where insulin and these incretin hormones will be produced, and these hormones act in the glycemic control, weight management, and everything. So in India, we have GLP-1 analogs like dulaglutide, which is available in the form of injections, and semaglutide, which is available in the form of oral medications. So these both classes of drugs are very much important in the glycemic management. Not only glycemic management, weight control, cardiovascular morbidity, improvement in the cardiovascular morbidity and cerebrovascular morbidity, improvement in the renal functions, like it delays the progression of the kidney disease and delays the progression of albuminuria in diabetes patients, and it acts on the weight also, so weight loss reduction, so in turn improvement in the fatty liver status. So all these things are the advantages of these SGLT2 inhibitors and GLP-1 analogs, so which are an important armamentarium in the diabetes management drugs. Recently we have a trial called flow trial, so where GLP-1 analogs has been shown as an advantage in preventing the albuminuria progression in type 2 diabetes patients. So there are studies, clinical trials which we are getting, so which is showing the best improvement in the progression of the complications.
Yes, that is very insightful. Till now, we have discussed about lifestyle interventions and preventing diabetes complication. Now, can you discuss about recent technological advancements in prevention of type 2 diabetes complications?
See, coming to the technology, so in India recently technological advances like continuous glucose monitoring is available. So though we are not using as rampant as in the Western world and Europe, so we have a continuous glucose monitoring in the form of Freestyle Libre. So we are using Freestyle Libre by about version 1. So actually this comes as a two variations, like professional CGMs and personal CGMs. Though earlier days we were using professional CGMs, nowadays personal CGMs, Libre 1 is very much useful for the patient in changing or modifying his diet or modifying his physical activity, weight loss, and take a decision for the insulin doses. So all these things are you guide the patient for better management of the diabetes. Okay, better management of the glucose control. Along with this CGMs, so there are some health apps also. So these health apps helps the patient to set the goals for weight loss. They give alarms, they give alerts. So in they educate the patient with the proper material. They provide the sources of the material, and there are some programs conducted by these online health forums. So the multiple forums gives the knowledge and education about the diabetes and its complications. That's how people are enriched with the information, so which is available in the online health forums and technology. So if all these things improve patient and healthcare providers collaboration. So that's how this technology is very much useful in improving the glycemic status, preventing the complications of diabetes. So one should follow the advances in the technology regularly and update them. Okay, so they should get updated.
Yes, it's fascinating to know how technology plays a major role now. Thank you, Dr. Kiran, for your valuable insights. Your expertise offer crucial guidance in preventing type 2 diabetes complications. Thank you to our listeners for tuning in. And to our esteemed healthcare professionals, if you are eager to delve deeper into medical topics or have questions, don't hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. Until next time, stay informed and healthy.